So we have seen in various conditions where it is used, and it is useful in many resistance conditions that we have seen earlier. Then next is levofloxacin. It is isomer of ofloxacin and largely replaces it. It is well absorbed from GIT, administration orally, intravenously, excreted unchanged. It has long post-antibiotic effect. That means the infection will not be there for long period. Long-acting single daily dose it is having. It is used in various infection, that is from streptococcus pneumonia, COPD exacerbations are there. In that it is used. It is used in the treatment of prostatitis, that is inflammation of prostate gland due to E. coli and sexually transmitted diseases. With exception of syphilis, means it is not used in syphilis, it is used as in gonorrhea. Due to its broad spectrum activity, it is utilized in wide range of infection like skin infections, acute sinusitis, nosocomial pneumonia. Now you know nosocomial, that is which is acquired in hospital. Then next is moxifloxacin. It is long-acting single daily dose. It is long post antibiotic effect. It is mostly used for the treatment of respiratory tract infection like pneumonia. Then COPD exacerbations. It is used for the treatment of severe bacterial infections including sepsis, peritonitis. It is most potent fluoroquinolones against Mycobacterium tuberculosis. It is poorly active against this Pseudomonas aeruginosa. Then resistance to fluoroquinolones, I think we have seen this also. It is affecting the efflux pump is developed and thus it is removed away. Then there is a decrease in the permeability which causes decrease in the, and there is alteration in the these enzymes. Because of the mutation of the enzyme structure, this enzyme will not allow this drug to bind, and thus there will be resistance to it. Then adverse reactions. It causes abnormality of bone and cartilages formations. It causes cartilage damage in weight-bearing joints. It has been found in animal studies. It has not been used, so it is contraindicated in children under age 18 and pregnant women. Because of this reason, they are not allowed. Then it causes photosensitivity. Similar kind of thing we have seen in tetracycline, if you remember, that when this is taken, the drug reaches to all the extracellular fluid, and because of that it reaches beneath skin, and when it is reaching to the epidermal layer, and when there is a light is coming onto it, because of that it will cause photosensitivity and photodermatitis, or even if the ointment or topical preparations are applied. So avoid sun and UV during therapy, these are expected. Then it causes tendonitis, that is tendon rupture. A few cases of rupture of the shoulder, hand and Achilles tendon have been reported. In CNS it causes confusion, insomnia, fatigue, depression, somnolence, seizures and QT prolongation. It has got drug interaction with many drugs, like it is a potent CYP450 inhibitor. CYP is one of the very prominent enzyme which is doing the metabolism. So it is a potent CYP450 inhibitor. It increases the plasma levels and toxic effects of anticoagulants, digoxin, theophylline. So all these drugs which are metabolized, they will have in activity, and so there are very popular are there with the theophylline, warfarin and cyclosporine. They are very prominent one because it can be toxic because of it. It has got interaction with antiarrhythmic agents, particularly in combination with class 1A agents. You must be knowing what are the class 1A agents, if you remember. Okay, and class 3 antiarrhythmic which prolong QT and may cause arrhythmias. Other antibiotics, they have no synergistic effect with any other antibiotic classes. A synergistic inhibitory effect of fluoroquinolone has been observed in the binding of neurotransmitter GABA, and thus it will have activity with benzodiazepine and other agents. Drug interaction with antacids. This concomitant oral administration of magnesium or aluminum containing antacids has been found to result into 6 to 10-fold decrease in the absorption of oral quinolones, so should not be given with antacids. With sucralfate it should not be given because it will not allow absorption, and therefore it should not be given. Then contraindications. These fluoroquinolones should not be used in various conditions. They are contraindicated in the patients which are having known hypersensitivity reaction with any of the member of fluoroquinolones class of the antimicrobial agents. So if it is one, then there is a cross hypersensitivity can occur, and then it can affect the patient. So these are the hypersensitivity, or we can see that it is a phototoxicity reaction. It is there. Generally should not be administered in the patient younger than 80 years of the age. We have seen the reason. What is the reason of this? That is, they are causing the problems in the cartilage or the developing bones. They are affecting the developing bone, and till 18 years of the age, these adolescents, they are growing, their bones are developing, and therefore it will interfere with the bone development, and cartilages can be weak. This is reason, and therefore not given. And the same reason it should not be given in the pregnant or the lactating human, because this will go into either fetus or in the infants, and which are either in the developing stage, and therefore it should not be administered. It should not be given to arrhythmic patient, because we have seen that it affects QT interval, and therefore it should not be given in the arrhythmic patients. Then complication. What complication it causes? It causes a typical complication that is called as ophthalmia venera. It is a dreadful complication of fluoroquinolone resistance Neisseria gonorrhoeae. This fluoroquinolone associated with a wide spectrum of musculoskeletal complication that involves not only tendon but also cartilages, bones and muscle. We have already seen that this is a major adverse effect it is having, and because of that this musculoskeletal complex, they can affect tendon, they can affect cartilages, bone and muscle, and that's why we are not using them for the person having age less than 18, because that was the developing age. So what are the fluoroquinolone uses? It is available in various formats, in various formulations they are available. It can be taken as a tablet or capsule in oral format. It can be given by injection for intravenous use, and it can be used as ophthalmic infection. So there are ophthalmic solutions are available, ophthalmic creams are available. Even ear drops are there. We call them eye ear drops. So they are available for ear also. So they are very good for various ophthalmic infections. And as I told you, ophthalmic preparation like ointments and ophthalmic drops, eye drops are available, ear drops are available. They are very important in respiratory infections, including anthrax. You must be knowing that that is bird flu and anthrax was developed some year back, around 6-7 years back. It was very bird flu was very there, or swine flu like thing rather. So it was because of the anthrax organisms, and ciprofloxacin was one of the most important drug which was used or in that. Must be those who want to have what we can say some more information, just as a general knowledge, they can see that during that period even America allowed, because America patent rules are very stringent, they do not allow the drug which is not patented, but during that period many Indian companies could supply ciprofloxacin because it was very severe case. So, and that is only the having highest activity. It is also useful in the mycobacteria because it is causing pulmonary tuberculosis. Then they are useful in the GI and abdominal infections. You will find that there are many drugs. Very popular combination is with ciprofloxacin or norfloxacin with anti-amoebic drug, because many times doctor do not have time to check what kind of dysentery it is. It may be bacterial, it can be protozoa or amoebic. So normally a combination of this is given. Very popular combination is there in market is called as O2. That is, there are two O's. One is this ornidazole and this ofloxacin. So this ofloxacin is O and ornidazole is the metronidazole derivative. So these are the drugs which are used in gastrointestinal and abdominal infections. Definitely in all cases, again, whenever there are surgical situation, in that also these drugs are fluoroquinolones are popularly used. They are used in case of infection of bones, joint and soft tissues. Now these are even given as a infection wise, or even as a preventive in case of surgeries. These are very prominent one. They are used in case of prostatitis, then urinary tract infections, particularly which are multi-drug resistant strains, which are not responding to many drugs, many antibacterial drugs. In that cases also they are used. They are useful in case of sexually transmitted diseases like chlamydia and gonorrhea. They are useful. Their mechanism already we have seen. It inhibits DNA gyrase and topoisomerase 4, and because of that it acts, or it has effect as a bactericidal. This drug is having adverse effect which are very common or very popular are tendon rupture, then affecting cartilage development or bone development in the person having age below 18 years, and therefore not given during pregnancy. It can cause seizure, it can cause prolonged QT interval, it can cause dizziness, it can cause confusion, it can cause photosensitivity, and these are the adverse effects. So here we finished ciprofloxacin or the other one. Now we will go by for various treatments which are there for various conditions. I'll suggest you to go through it, all these antibacterial agents, their mechanism. These are the basic antibacterial agents. We started with sulfonamide. We have discussed various beta-lactam, that is penicillin. We have discussed all various generation of cephalosporins. We have discussed various generation of these fluoroquinolones or quinolones. Then we have gone through other antibiotics which are there, which are used. Example are chloramphenicol, then aminoglycosides, macrolides, and many others which are smaller like imipenem and streptogramins and all. So we have seen almost all kind of antimicrobial agents which are used for general purpose, which are used in case of certain infections, and which are rather general. In general means they can able to act on a bigger class, wider class. Wider class here it means they are active against maybe gram positive, gram negative, aerobic, anaerobic, whatsoever. It is a bigger class. Now whatsoever we shall go for now is various drugs which are used in treatment of a specific infection, some of the specific infections. So in the next section we will go for example treatment of tuberculosis. Although tuberculosis is a disease with the microorganism similar to bacteria, they are also bacteria as other bacteria are, but they are very typical in nature. Okay, I'll suggest you read about tuberculosis bacteria before that, and what are the typicalness it is having, in what are the conditions it is having. These all things you must have studied in microbiology. I want to know it. Please write it in group, everybody, those who are reading in that, what are the typicalness or peculiarity, or if you compare with the other bacteria and mycobacterial tuberculosis, then what you will find a difference in that. So what kind of microorganism they are, what is the typical thing, what is the difference thing, either structurally, functionally, their infection type. So these are typical mycobacterial infections are there. So how mycobacterium differs? There are various mycobacterial infection as we have seen, or we can see it again. We have seen it earlier. Some of the drugs are effective, including fluoroquinolones and some of the cephalosporin. They are very, very effective in the cases we call it as atypical mycobacterial. We have seen streptomycin, although it is used for general purpose, but it is effective in the mycobacterial tuberculosis infection. But there are many other drugs which are useful in mycobacterial infections, but they are not useful for, or they are not used for general infections. So these are the drugs which shall be seen. Very interesting thing is the drug which are active in mycobacterial tuberculosis or mycobacterial infections, they are not that active in other bacterial infection, or they are not successful in that. But there is a drug like the antibiotic, that is rifampicin. This can be active against other drugs also, but it is not preferred because these drugs are prone to get resistant very early, and if it is used, then rifampicin is very, very important treatment in tuberculosis, because we have seen that there are very limited drugs are useful in tuberculosis. So in that case, if we use rifampicin for general infections, then maybe rifampicin will develop resistance, and if simultaneously this bacterial infection occurs along with tuberculosis, then this will not be there, or this resistance form can be carried or transferred to the mycobacterial tuberculosis bacteria, and therefore this will become useless. This will become no impact will be there. So this is how we are going for. I'll suggest you to read everything. You go through this. You read about what is mycobacterial. Is there what kind of it is? What its difference are there with normal population of bacteria, and then why it is difficult to treat it, the infection. What are various other this one infections are there from mycobacterium family. Okay, there are various infections which are occurring because what are various family members of mycobacterium family, and what kind of infections they are causing, what kind of drug we are going to use in that case, that we will be studying as a part of pharmacology. So I think today we'll stop over here because most of the drug we have seen, we have gone through it. If anything you come across which somehow I have skipped it or I have missed it, I am trying to add maximum because I am trying for the latest whatsoever possible. If by chance if any drug is skipped, you just go through the book and let me know. One important announcement I wanted to make, you please circulate in WhatsApp group immediately, that today we had a meeting, and during meeting it was planned that by next week or after next week somewhere the schedule will be declared for your first sessional examination. So already we have finalized our first sessional syllabus. We have completed it. We are far ahead of it. So let me know you whatsoever syllabus we have finalized. I remember what we have finalized, but let it come from you in group, and accordingly it will be an MCQ based examination. Please put it there in group. It will be there, and accordingly some time will be given, schedule will be given. So I am informing you much before it. Try to go for it. Try to read the topic. If you have any difficulty, we can have one or other class for difficulty solving if you are reading and if you are having difficulties. It is very clear that questions will be MCQs, multiple choice questions, and on that basis you will be evaluated. That can be added as your sessional marks. So please go through it. If you have any difficulties, please ask. Finalize the syllabus as I told you. If you can make out questions, it is well and good. I do not assure that same questions will be asked, but at least it will give me an idea that what kind of thing you have read, what you are understanding, and if you are skipping something, I can definitely add into it. So please go through it and have a good time over there. Today we are cutting it short because for starting new topic I wish that you should go for basics of it from microbiology. See, after that we'll go for what's your topic. As I told you, you compare with the syllabus, chemotherapy of various this one. So let me tell you, let me go through it once fast so that I can tell you what the situation is. So what we have studied from chemotherapy, we have studied introduction, that is our basic principles in the chemotherapy. We have studied it. We have studied sulfonamides and cotrimoxazole. We have studied penicillins and cephalosporin, tetracycline, chloramphenicol, macrolides, aminoglycosides, pauline, yes, pauline and polypeptide antibiotics, quinolones, fluroquinolones, we have finished. So most of these antibiotics are over. Apart from that, we have added about the new one like streptogramine, linezolid, etc. There are many newer we have put into because they are all important antibiotics. Then after that we'll go for various drugs which are having typical situations. Example of these are antiviral agents, chemotherapy of tuberculosis, as I told you, and leprosy. So we'll go for first go for tuberculosis and leprosy. I told you to read about Mycobacterium tuberculosis and various mycobacterial species. Then please have your reading on viruses, their development, so that when we'll go for antiviral, it will be helping you. Malaria, that is protozoas, with other protozoal infections like amoebiasis, giardiasis, anthelmintic. Then these are various worms which are there, and then we go for chemotherapy of cancer. So most of the syllabus is over. If you wish to have a revision on any topic, you just put the difficulties on that. I'll rather have that you are discussing it, you are going through it, and I will just have a what we can say supportive role into it, because it should be from your side that you have read it, what difficulties are there or what understanding you had. So you go through it. Once it is there, we will be finishing our syllabus after completing all these topics. I think most of other topics we have finished. Only chemotherapy which was remaining, we are in the middle of it. So go through it, and if you have any difficulties, you can definitely ask me. You can definitely put it on group. So take care, be safe, and ask the questions. Please go on reading and take care. So here we finish most of the things related to chemotherapy. Almost 50% of the syllabus from chemotherapy we have finished. Okay.